Mark,
Hi, Dr. Caine. How are you?
Mark, I can't hear you.
You can't hear me at all?
Hold on. Let me see. Oh, yeah, that's right.
Can you hear me all right now?
Yes, sorry, I had my volume down. I didn't realize.
Okay, sounds good. I've got the slideshow ready to go as well. And I think we've got the mayor in his office. So, Mayor, I think we're just about ready to go when you're good to go. Mayor, when you're ready, we should be good to go.
Okay, good morning. Dr. Caine will be on in a moment to go over our most recent COVID data for Indianapolis, Marion County. But first, I'd like to talk about something that's familiar to the players who will be taking the court this month, and that is the fundamentals. Basketball is a beautiful game, but undergirding some of the most memorable plays are the most basic principles, the most basic fundamentals. You know, crisp bounce passes, pure jump shots, low to the ground, up in your face defense. Well, when it comes to fighting the coronavirus, we've been talking about the fundamentals for nearly a year now. Wearing a mask, social distancing, washing your hands, and now, when you're eligible, taking your shot. As we enter this next stretch, we must resist the temptation to stray away from these basic principles, these basic fundamentals. Earlier this week, the CDC provided guidance for those who are fully vaccinated. It is cause for hope, especially for older residents longing to visit their children and their grandchildren. But it wasn't meant to be a signal to return to a pre-pandemic normal. Now, I got my Johnson & Johnson vaccine just a week ago today, last Thursday. That means before too long, I will have all the benefits of the immunity that the vaccines provide. But even so, when I'm in public, I still need to mask up, and I will. When you see me this month, I'll be wearing a mask and keeping socially distant. Because even though I've gotten the shot, I still need to do my part. I still need to help protect my friends and neighbors, my family, and myself. And I still need to listen to the health experts. Now, Indianapolis is now in the national spotlight. The Horizon League champions are crowned. We're in the middle of the Big Ten tournament. I was fortunate enough to be able to attend both games last night, the first session of the Big Ten tournament, where both Minnesota and Penn State advanced. And within the next week, March Madness, the Division I NCAA men's basketball tournament will be tipping off. Dr. Caine and I have worked with the NCAA, the state of Indiana, the State Board of Health, and civic partners to make sure we can have a safe and a successful and a healthy March. Those measures have been the big things, like safety plans for players, safety plans for fans, fine-tuning capacity limits inside the venues that will be used to house the basketball tournaments themselves, and frankly, capacity limits inside our bars and our restaurants, inside our hotels and our music venues, even changes that have been made to the infrastructure of downtown spaces. But for March in Indy to be truly a success, it's going to take all of us, residents and visitors, players and fans, practicing the fundamentals. Fortunately, I know we can do it. Our residents, our businesses, particularly hospitality industry businesses, even the NCAA. We have all had a year of practice to prepare for this final stretch. Remember what made this month possible in the first place, and keep to the basics. We've come so far. We really have come so far over such a long period of time. Let us together commit and guarantee that when April does come and a national champion is crowned, the last team on the floor isn't the only team celebrating a monumental victory. I want Indianapolis, and I know you do too, to be in that winner's circle. So with that, I'll hand it over to the expert, Dr. Virginia Caine, head of the Marion County Department of Public Health. Dr. Caine.
Thank you, Mayor. I appreciate those really great words for our city and the challenges that are going to put us in the national light. You know, unlike this time 1 year ago, this week began with news that should make us all hopeful that the CDC issued the first guidelines for individuals vaccinated against COVID-19, which stated that fully vaccinated individuals can gather in private indoor settings without wearing masks or social distancing. Now this is the if everyone gathering has been fully vaccinated against COVID-19, or if they're fully vaccinated individuals are gathering with non-vaccinated members of one household who do not have any significant underlying health condition. Let me say this again. CDC is saying now that fully vaccinated individuals can gather in private indoor settings without wearing masks, without doing social distancing, if everyone gathering has been fully vaccinated against COVID-19, or if you're fully vaccinated, individuals can gather with non-vaccinated members of one household, of just one household, who do not have any significant underlying health conditions. Now, this is welcome news for grandparents. Oh my goodness, who have missed hugging their grandchildren, and families who have missed important moments in the last year. Now, these new guidelines will underscore the importance of every member of our community signing on for the COVID-19 vaccine as soon as they are eligible by visiting OurShot, one word, .in.gov, or you can call 211 so that soon we can all safely return to the activities we loved and have missed over the last year. Now, it is worth mentioning that the IU Health Neuroscience Center in downtown Indy has appointments available for eligible residents as soon as this week. IU Health Neuroscience Center in downtown Indy has appointments readily available for anybody to sign up this week. However, and this is especially important to remember as we begin celebrating the festivities that the month of March brings to our city, in public, individuals must continue to wear their masks, wash their hands, watch their distance from each other. And as I will detail momentarily, Marion County's COVID-19 statistics brings more hope as our positivity rate, our new confirmed cases, and our number of deaths show positive signs for our community. But I will echo Mayor Hogsett in saying that while we can see the end of this tunnel, we have not reached it just yet. So please keep doing your part so that we can all enjoy a safe and fun month of March and continue to slow this spread of COVID-19 in Marion County. And so now I would like to just walk you through our latest COVID-19 data for our county. Next slide. So when you look at the first slide, what was it? Our gold standard of having no more than a 5 positivity spread in our community. Well, bless our soul, we are down to 2.9% positivity in this community. And that's all because of all of you doing your part. And we've been below 5% now for going on 23 days. 23 days. We're 3 weeks under the 5% positivity rate. Next slide. And remember, we were at 16.4% positivity back in November, early December, 16.4. So all of you have just done an incredible job, and we appreciate that. When we look at our newly confirmed cases for Marion County, we are now seeing a 7-day average of about 104 cases. Do you know in December we had 2 days where we spiked over 1,000 cases, and we were experiencing 900 cases a day, 800 cases a day. We are now down to 104 cases. But our gold standard is to get down to 35 cases or lower. So we're still not there yet for that metric, and that's an important metric. We want to be reporting no more than 35 cases or less a day, but we're making significant progress. Next slide. So our emergency room visits, as a result, people come into the ERs with COVID-19 symptoms, that has been continuing to drop significantly, and we're experiencing no more than 11 visits a day in this entire Marion County with all our hospital systems. So it has gradually come down significantly. Next slide. As a result of that drop in people having symptoms of COVID-19, our first-time hospitalizations who were diagnosed for COVID-19, we're only averaging now about 3 cases a day in Marion County. So we have dropped to just, we are on a decline, and we want to continue that way. And so looking to see no more than 3 hospitalizations a day. Next slide. As a result of that, and this is probably the most important point, we're not seeing the deaths like we saw before when we were at our height of this epidemic. And we're experiencing now less than one death a day related to COVID-19. And we want to continue, so we're having no deaths a day from COVID-19 in our community. Next slide. How does Marion County fare compared to the surrounding counties in terms of new cases appearing in their communities? You will see that Marion County, as well as Morgan County and Hendricks County and Hancock County and Shelby County have the lowest number of cases per 100,000 residents being reported. So we're at 11, and we're doing a significant increase of cases. We are noticing a slight bump in cases in Hamilton County and Boone County and maybe Johnston. It's a little bit too early to tell, but we are holding steady. We're being basically flat, and we want to continue that way unless we're going downward for the new cases per 100,000 residents in our communities. Next slide. Now, how does it break down in regard to cases in COVID-19? Well, as you will see, in our oldest age group, over the age of 60, we've been basically remaining almost just a slight increase since September, with making only about 15% of the cases. When way back in April, that age group was making almost 40% of the cases. So we've done a remarkable job. And this is where I think we're seeing the difference also. Maybe the vaccine is making a difference in our older populations. And so I'm looking to continue to see that percentage decline. And the 40 to 59-year-olds is remaining flat and steady. And our largest group to date, who we're seeing the largest number of cases, and one we have to really keep our eye on, is the 20 to 30-year-olds, 39-year-olds, the 20 to 39-year-olds, with nearly making 40% of our cases. If we could halve those cases, my goodness, we could reach our 35 cases per day. I've got to knock out those 20 to the 39-year-old groups cases. We also look at the less than 20-year-olds. So these are from 0 to 20-year-olds. We're seeing a slight increase, but in that age group, we're seeing a significant increase in the 18 and 19-year-olds of that less than 20-year group, making the significance of the reason for why we're seeing a 18% in February compared to 15% in January. Next slide. Now, this slide highlights how from February the 1st, you will see that all of the age groups, older adults, college students, K through 12, less than 5-year-olds, everybody had a significant decline up through the beginning of March. But I want to point your eyesight at the very top line. That's the navy blue line. That is our college age group, 18 to 24. We are starting to see a significant increase in our college students in Marion County for COVID-19. Look at the increase, that it has not been plateaued or laid flat like our older adults having no more than 12 cases per 100,000 population on a 7-day average. Our K through 12, they're staying steady at no more than 8 cases per 100,000 students. That's remarkable, doing fantastic. And our older adults are doing great too. We're somewhere around about 6 cases, and our less than 5-year-olds are at 5 cases. But we've got to really make some inroads on that young college group because of the rise we're now starting to see since about the first week in March. Next slide. When we look at how many individuals have been vaccinated in Marion County, fully vaccinated, meaning that they have received both of their shots. For those who started the Pfizer and Moderna vaccine, they've reached up to 9.2% of our residents are fully vaccinated. We hope to continue to see that number rise because that's going to make the difference of us meeting our challenge here and being able to return to normal. So I believe that may be my next to last slide, which is when we look at the percentage of people who are vaccinated by population, you will see that of the 80-year-olds and older, 50% of them are already vaccinated so far. When we look at the breakdown of the ages between 70 and 79, 45% of them are vaccinated. And when we look at the 60 to 69, and that's the area where we are now, age group, we vaccinated about 14.2%. And then, but this is as of March the 9th. So we were looking to get some more data since we had the IMS vaccination rates and some other hot spots that popped up. So we look to see that number grow significantly to 60 to 69 once we are able to get that new data of people that were vaccinated. And then, of course, you're seeing at the lower age groups, because these are individuals who meet special conditions, like they may be a Down syndrome patient, or they may be a sickle cell patient, or they may be a cancer patient that was able to get vaccinated besides the age population. So we still have our work cut out for us. We want to be finished meeting our herd immunity goal of 80% of Marion County vaccinated by the end of June. So we're praying that we will be able to receive more vaccine in order to meet the needs of our community. And with this, Mayor, I will stop. Thank you.
Thank you, Dr. Caine. And as always, folks who are tuning in, members of the media who have questions, we'll turn to the question and answer portion. You can put your name and outlet at the bottom right, and I will call on you and unmute you, and we'll get your questions answered. So first up, looks like, I believe it's Stephanie Wade of WRTV. Stephanie?
Hey, thanks so much for having this. I just had a question about when we're having the tournament here, who will be enforcing capacity for businesses and social distancing and making sure everyone's wearing their masks?
So the major part of that responsibility relies with the Marion County Public Health Department and our staff. So we're going to up our surveillance related to the different businesses, related to the March Madness, and try to really continue to warn people if it looks like it's a really egregious event. You know, we may have to close events, but the bulk of it will be with the Marion County Public Health Department.
Mayor?
Yeah, let me just add that I very much appreciate the Marion County Department of Public Health, and they are going to be, obviously, as Dr. Caine has indicated, taking a leadership role in enforcement of our capacity limitations and our safety standards. But I can't help but add at least one observation, and that is in working with the Restaurant and Lodging Association, other civic partners, other businesses, particularly in the hospitality industry throughout the downtown area, where primarily the activity, to the extent that there is increased activity, that will be where it is located. I am very confident that they are all responsible business owners. And while, there will be increased activity, we are relying on people throughout the downtown area who own and operate businesses who have been through enormously challenging times to understand that short-term gain is long-term pain. And they appreciate that. We appreciate that. And that is why I'm confident that with hopefully very, very few exceptions, the business owners themselves will self-regulate and make sure that they are in compliance. We want them to be prosperous. We want them to return to a sense of normalcy. We want them to make money off of our visitors and those who come downtown to enjoy the tournament or to enjoy restaurants and the like. But we also want them to be responsible because they understand perhaps better than any of us that the ongoing success of their business model is dependent on a return to an even greater sense of normalcy than we currently enjoy. So I want to throw kudos to the business community downtown Indianapolis, who has been working hand in hand with Dr. Caine and her department in terms of public safety plans for visitors and patrons of our downtown hospitality establishments.
Oh, Dr. Caine.
Sorry. Thanks for really mentioning that too, because a lot of these establishments have their own security, which has just been tremendous for us. And they have a better idea about their customers and how to manage and how to control them. So I definitely want to give special kudos to them who are helping to bring us these additional resources in order for us to have a great and a productive environment for our customers.
Thanks, Mayor. Thanks, Dr. Caine. Next up, we have Erica Heron of Indy Star.
Two questions. Thank you. First, Dr. Caine, last time we talked, you had mentioned you were going to make a decision about high school. Just wondering if it is okay for high schools to return in person full time. And then if you have any plan or guidance on vaccinating Marion County's teachers now that they'll be eligible at all locations starting Monday.
So we had begun think of. So yes, first of all, we are allowing high schools to return back to school full time, and so that's definitely the case. But I think the little additional caveat related to that is we had a number of schools that were in the hybrid format, meaning that they couldn't come all in person every day of the week. And based on new CDC guidelines, even though 6 feet social distancing is the gold standard and definitely creates a much, much more greater safe environment, they did have, if you met certain stipulations, based on structural concerns, you could reduce that social distancing down to 3 to 4 feet, and they all return back in person. So that is what we are approving, that they can come back to high school as long as they're fully masked. They can do the 3 feet social distancing. They all have to be faced in a certain direction. They all have to be seated in their regular seats. You can't have kids moving around in different seats. They have to be in assigned seats. And we have to have what's called very robust contact tracing available. So in case a child or a teacher maybe become positive, it doesn't mean that it comes from the school setting, but it could be outside the school. We need to be able to jump on that really quickly and make sure we're preventing any spread of the COVID-19. I'm happy to say we categorize our schools that are maybe in what is our red zone. That's the hottest zone you can get with positive cases. We currently, I believe, have no more than 6 cases right now that are in the red zone, and we have none in the orange zone, which is the level next to that. So, and that's over 300 schools. I think that's remarkable. So so far, we're impressed with what's happening in our school settings and with our school leadership. They're doing a fantastic job.
Thanks, Dr. Caine. Next question is from, Mayor, yep, go ahead.
Well, before we leave the school setting, I feel obligated, again, based on my admonition to try to be mindful of basic fundamentals. This upcoming weekend will also be the boys regional round of IHSAA basketball tournament competition. I believe that there is only one venue in Marion County that is hosting regional. And I want to compliment the IHSAA on their efforts to put in place, depending on the venues and depending on the sizes of the gymnasiums that are being utilized for the tournament. I want to compliment the IHSAA for putting in place, I think in cooperation with their local county health departments, responsible plans. But I don't want to pass up the opportunity to remind everyone who loves basketball, and particularly high school basketball and the IHSAA boys tournament, that the same types of capacity restrictions, the same types of safety restrictions that are applicable to the Horizon League, to the Big Ten men and women's tournament, to the NCAA. All of the cautions that we are taking here in the city of Indianapolis are equally applicable on a county by county basis, according to your county health restrictions for these boys regional tournaments, because we don't want to let our guard down as we get together to cheer on our favorite teams. On Saturday morning, I'm going to go to Southport and watch the Ben Davis Lawrence North regional game. And Southport has, as you know, an iconic and huge basketball arena, which will be, limited in its capacity. But throughout Indianapolis, at least as far as Dr. Caine and I have jurisdiction, but I would encourage everyone throughout the state of Indiana to not lose sight of these restrictions that we've been so diligently putting in place to make sure that fans who are in attendance at these important basketball events are in compliance with the health restrictions that are applicable to them. So sorry about the added commercial, but that's upcoming this weekend as well.
Thanks, Mayor. And just looking at the number of questions we have coming up from folks, I would just ask that the folks that we call on, as much as you can, if you can keep it to one question, that way we can get around to everybody. So the next question will be from Darius Johnson of Fox 59 CBS 4.
Hey everyone, how are you? Thank you so much for having this. I first wanted to know, I just have one question. I know a lot of communities or a lot of different cities, they are starting up mobile vaccination sites in some of these hotspot communities where minorities may be, or just in some of these zip codes where you may have a lot of minorities who aren't as responsive to the vaccine. Are you all having any plans to try to do that as we are trying to see if we can get more doses and more vaccines available for Hoosiers?
So I think that's a very great question, and yes, we are. We are working with some faith-based institutions and hospital systems. We're even working with some fraternities, planning on doing some mobile hotspots vaccinations in the areas based on what we call a social vulnerability index, looking where some of our hard to reach populations are not being vaccinated. So look to see those announcements probably within the next 2 weeks of where those locations are going to be. We've got to definitely address our homeless populations as well. And so that's really critical for us because we want to make sure we're having a equitable distribution of the vaccines to everyone, especially anyone that's meeting our highest risk populations for complications, hospitalizations, and death related to the COVID-19 infection.
Thanks, Dr. Caine. The next question looks to be from Sherry Radovsky of the Star.
Hi, Dr. Caine. I was wondering if you could detail any more how the health plans for the fans will be different from what was already in place for fans who are attending Pacers games and football games when the Colts were playing.
So what you will probably see a little bit is, even though our capacity is up to 25%, you won't always see us utilizing up to that level of spectators. I think that's the first thing. Secondly, we're going to have just a little bit more intensive amount of cleaning with our fans in the process of moving them in and out. So as we have a team come in and you see a basketball game play, those fans will be removed so that we can do a thorough cleaning for another game that may be set up in terms of a basketball event. So it's a little bit more intensive of a cleaning process, I will say. Now, the most incredible thing is the bubble effect in regard to all the teams and all the staff related to the event, where they are being tested every day, 7 days before they even get here, and will be continued with the gold standard while they're here every day and get the results every day. And not only that, we have like the second tier people. So like your people who are doing the announcements of the game, or your scorers and all of those individuals. So they will be tested too before coming into Indianapolis, and they'll be tested on a regular scheme that we have. So this is way more intensive a process than compared to what we had with our Indianapolis football coach games or other basketball tournaments that we have had. It's a very aggressive program. And I love this new technology that they're going to have for all of the team and the staff members. And that is, it's a device that every person will have to wear of all these teams. And if you get within 6 feet of someone, it gives you the time and who that individual is within 6 feet and how many minutes. And that's going to be a daily surveillance process that we look at very carefully. That's so robust from a contact tracing standpoint. It's just going to be phenomenal. And if you're a spectator in our seats, I will know who you are. I will know what spectator is sitting in what seat. I will know what hotel you're staying at. If you're staying at a hotel, I'll have an address. So I'll be able to quickly and very robustly be able to identify anyone who turns out to be positive in our community, and we can do our investigative evaluation recommendations and testing very rapidly.
Thanks, Dr. Caine. Mayor?
Yeah, Mark, I know you're trying to move us along here. So I apologize for kind of chiming in because Dr. Caine is my leader and I defer to her. I just simply, in answer to your question, and this kind of goes back to the question earlier asked by Stephanie, I did attend the first session of the Big Ten men's tournament last night over at Lucas Oil Stadium. And I must add to all the safety protocols that the Marion County Department of Public Health have instituted and all the many things that Dr. Caine just identified, I was very impressed as a fan in attendance how many times there were public announcements over the PA system reminding each and every fan to keep your masks on, to only eat and drink in your seat, to stay seated, to not move around. And then I was also, speaking of enforcement, I was also impressed by the number of hosts, the folks with the green jackets on, who were monitoring aisles and carrying signs, looking out over the crowd, the signs saying, you must wear a mask. And if they would identify a certain area where people were not wearing their masks, they would very, gently hold up the sign and then go up and talk to them and engage the fans in saying, these are the rules. You must follow them. And in every instance where I saw enforcement was being meted, they were in compliance. So I know that the fan attendance will probably increase over the course of the weekend. So we'll have to double down in terms of monitoring and enforcing. But I got to tell you, based on my experience last night, not only was everybody socially distanced, for the most part, everybody was masked up, but there were put in place by the NCAA and by the constraints imposed on them by the Marion County Department of Public Health, a full coterie of enforcement mechanisms to remind people that while they're in the stadiums, that they need to comply. And I feel very good about that.
Dr. Caine.
We've got a lot of experience with, for example, the Big Ten. I mean, we got that experience last year. We talked constantly with their medical policy person. I was just on the phone with that person on Thursday. So the Big Ten folks are very familiar with us, our Indianapolis Sports Corp. So we all kind of meet on a regular basis. We try to highlight any issues that may have happened in another communities to make sure that it's appropriately addressed here. So we've just got tons of experience. We know each other, and I think we're well equipped to handle any emergencies or issues that may pop up. I feel really good.
Thanks, Dr. Caine. Next up is Jill Sheridan of WFYI.
Hi. Just to clarify, so whatever plans the NCAA had to submit, safety health plans, those have been accepted and they don't need to submit any further plans. Is that correct?
They have submitted a tons of individual plans on every aspect known to man. Yes, I think we have all of their plans now.
And Dr. Caine, that question, is she saying that those have been accepted and those are like set to go, or was there any more?
We still have a few that we are reviewing that has not quite yet been finalized. But basically, everything that's in those plans we've discussed significantly over and over. We tweaked and whatever. So we should not have any surprises in the few plans that we still have to approve.
Thank you, Dr. Caine. Next question is from Abdul Hakim Shabazz of Indy Politics.
Yes, Mr. Mayor, Dr. Caine, just a real quick question. As we're marking the year since COVID-19 hit the state of Indiana, of the past year, what have you guys learned? What would you have done differently? What are just some of your general thoughts on how things have gone over the past year with COVID-19 here in Indianapolis?
Dr. Caine, you want me to take a crack at that and then
please, thank you.
Then hand it off to you. Abdul, I think the question really allows us to reflect back on how difficult this year has been how really unprepared our country as a whole was when the virus first appeared in March. But I take, and I'm not objective about this, but I take particular pride in the leadership of Dr. Virginia Caine, the Marion County Department of Public Health, for putting together and putting in place plans that have allowed us to get to the point where we find ourselves today. Now, there were setbacks along the way, admittedly. After the 4th of July holiday, we anticipated an uptick in the number of positivity and cases. Then there were some difficult times in the fall. But part of what I'm most proud of is, and I thank the governor for his willingness to allow us in Marion County and Indianapolis, because we are kind of a unique community in our state. I mean, it's by far the most densely populated city in the state. I applaud the state's willingness and Governor Holcomb's support in allowing Dr. Caine to make decisions, which I could support, which really went slower and more deliberate than other areas of the state. And I think it has allowed us, as Dr. Caine indicated earlier in her comments today, to get to a point. Doctor, remind me how long we've been under 5% now. We're at 2.9% positivity.
We're over 3 weeks.
Yeah.
Going to 4 weeks.
Yeah. And so I'll close my answer just by saying, if I had it to do all over again, I guess I would get on a plane to Washington and try to lay down in front of cars where decisions were being made as to how to keep the virus from spreading around the country. But absent that, I think that to the extent the virus appeared in Indiana and started to spread, as it did in all 50 states, I think Marion County and Indianapolis's response has been measured, has been deliberate, has been difficult at times, has been frustrating at times, but because of the cooperation we've received from businesses and residents throughout the community, I think we're in a place where, as Dr. Caine indicated earlier, we're not in the clear yet, but we sure can see the light at the end of the tunnel. Dr. Caine?
So I would just say that I had significant surprises at the start of this epidemic, because, you're supposed to have a national stockpile of personal protective equipment, and was shocked at the amount of reserve that we had there. We still suspect that some of it might have been removed to be offered to other states that might have been in a greater crisis than us. But the bottom line was we didn't have the ample amount of personal protective equipment. And then shocked that, like, just N95 masks that you take for granted, every hospital system, every urgent care, you take that for granted, that we didn't have that supplies, because some of those companies were selling our supplies that we traditionally get in the United States to outside countries because they can get more funding. And so those things got us in the business of really scrambling, trying to look at different vendors. Is this a scam or is this a real product? Mm-hmm. And so those were some of our challenges very, very early. But also, I think what was really critical is no matter what anybody tells you, unless you have a state health department working very closely with their local health departments, and they're working hand in hand, having the ability also to interact with the federal government, you will not have a protective environment. And so I just want to give kudos again to having that type of relationship and communications with the state agencies under Dr. Box and Dr. Sullivan has been huge, but it's about the collaboration in Indianapolis. My God, those hospital systems stepped up to the plate. Those healthcare workers stepped up to the plate. Our fairly qualified community health centers, health people stepped up to the plate, and I can't tell you how many private providers, healthcare workers, social service agencies, and everything was just tremendous. So that's one of the things that I learned. But we got such an array of experts here, just the school system, leadership, whether it's public, private, Catholic, charter schools. I have just an enormous research for all of them because I learned a lot, okay? This is a balancing act. Work with the Chamber of Commerce, trying to look from an economic standpoint. How do you balance? What restrictions you put in place? What kind of recommendations can you make that will balance the economy, safeguard our businesses, and yet at the same time trying to protect the community? And that's a juggling act. And we know that the science with this COVID-19 changed and was changing, and we had to adapt based on the circumstances presented to us. So I think we did a fairly good job. I had great partners. I want to say special thanks to Dean Paul Haverson, founding dean of the Indiana University School of Fairbanks, and his staff, who've been with us from the start, just done an incredible job with us. We've sought expertise outside the state, working with the CDC Foundation, Results Saving Lives under Dr. Tom Frieden, who they look at all different communities and find out what's happening. And also, I work with the 32 largest cities health commissioners, and we meet on a monthly basis, and that's just been immense for us. But the most important thing was that this community stepped up to the plate. They did what they needed to do to change their behavior, enhance education around all their friends and their colleagues. We wouldn't be here if it was not for them. And I have to congratulate you all, you media, because we got to get the message out from a communication education standpoint. And you've been with us step by step, helping us get that message out, providing clarification. So I've just have enjoyed having this relationship with all of you. I just can't thank you enough. Thank you so much.
Thanks, Dr. Caine.
Oh, the mayor, I have to compliment the mayor. Please, please, I've just got to say this. It is such a enjoyable experience when you can interact with someone. The mayor can grasp this stuff quickly. You know, you can show him something, give him a page, tell him something, and he gets it just like that. You don't have to spend a lot of time explaining things to him. So besides his theological background, he must have had a public health background somewhere in his childhood. I don't know where he got this from, which of his parents he got it from. And it's just been such a great experience working with Mr. Paul Babcock, who was his point person on COVID-19. We sometimes, and I shouldn't tell you this, we have too much fun sometimes, but we have spent late hours. You know, the mayor will call you after midnight, you know, if it's important. You just need to know that about him, okay? And he seems to have spread that addiction to all of his staff there too, in City Hall. So we've worked long nights. Some nights we didn't even sleep trying to make decisions. And I just appreciate working for an administration that is committed about doing the right thing, but also has the ability to make tough and hard decisions. Sorry, Mayor.
Yeah. Thanks, Dr. Caine. As much as I want to end it on that, I do think we do have time for maybe one question, maybe two. We'll see what we can get. So Next up is Erica Washington from Chalkbeat, Indiana.
Hi, thank you so much. Dr. Caine, I have a question. So my question is, I was trying to figure out why there were a few school districts, like IPS being the main one, that opened full time in person before this announcement that high schools will be able to go back in person. I wanted to know how they were able to do that and say that they're able to go back. The high schools are able to go back before this announcement that you just made.
So actually, I made this announcement to all the school systems at our last press conference. And so they were told, and I gave them the approval to start.
All right, thanks, Dr. Caine. Just time for one more, I think, and then anybody else, feel free to follow up myself or the communication staff of the health department, and we'll make sure you get your questions answered. So we'll go out with Alyssa Donovan.
So, hey, Mike, I got to say one thing. This is the most important thing.
Sure.
I'm not worried so much about March Madness as I am worried about spring break. Spring break. You look on television, you see what's happening in Florida. I'm asking everybody who is going on spring break, please continue to practice what you practice here in our county. And you need to look at our travel site, because our travel site states if you go to some states where the cases are significantly high, you need to quarantine and isolate when you come back into our community. So please wear those masks, do those social distancing, talk to your kids who are of the college age group, because that's the number of cases where we're seeing a significant increase. And think about your grandparents, think about your parents and your friends. So spring break, please do the right thing.
Thanks, Dr. Caine. I did call on Alyssa, so I do feel I've got to give her a question. So Alyssa, I'm going to unmute you now.
Thank you so much. I just wanted to know, is there any concern about a surge after the tournament? Dr. Caine, you showed some great numbers that were trending in the right direction, but we have a lot of people coming into the city.
So I'm not as concerned about the surge. I don't to be here as long. So when we've had our surge, we had a surge out of Thanksgiving. That was 4 days. So we see a significant increase related to that. But our biggest surge occurred after the Christmas holidays when people were off 10 or more days. So I am greatly more concerned about spring break for our own residents contributing to a community spread than I am about March Madness, to be honest and frank.
All right. Thank you, Dr. Caine. Thank you, everybody, for another good press conference this morning. As I said, feel free to reach out to myself or communication staff of the health department if we didn't get your questions answered during this session. And I will send out the slide deck after this press conference pretty soon here. So thanks, everybody. See you soon.